Hey everyone, today I'm going to discuss evidence-based review about the evidence behind using mindfulness meditation as either a monotherapy or an adjuvant for chronic pain. And as you watch any of my previous videos, and if you haven't, make sure you do, you know I'm absolutely fascinated with mindfulness and meditation in general. And just in case you haven't watched any of my previous videos, I want to clearly define what mindfulness is. And it's bringing an awareness and openness and an acceptance to whatever is currently happening in the present moment. So it's not visualization or relaxation or self-talk therapies, positive self-talk, where you're trying to change what you're feeling. It's just trying to be aware and accepting and present with whatever is happening at this moment right now. And chronic pain is an area I'm absolutely fascinated in medicine, as I think it's so complex, but it's something I think currently right now we don't treat well enough. And I've had very interesting conversations with my family med preceptors, anesthesiologists, talking about, I think we're in this mindset, kind of like we're stuck in kind of with the infectious model care, where we think we know the agent, we can kill the bacteria and cure the disease. Where I think chronic pain, and I have a previous excellent video from a group out of Australia, so definitely make sure to check the link above, watch that video. It really describes chronic pain beautifully illustrated in 5 minutes. But I think it's much more complicated than just a pill that's going to solve that problem. And it's one of the main reasons I'm so fascinated with anesthesiology and the application of anesthesiology in chronic pain, which I think is really cool. And I've seen some really cool results, seeing patients in family practice before the anesthesiologist giving the chronic pain injections and afterwards, and I've seen great results. But I think we can't just rely on interventions and surgeries. We have to promote and empower individuals. I think mindfulness meditation has very promising aspects. So what does the best available evidence? So I looked at a systematic review and meta-analysis done in the Annals of Behavioral Medicine. It published in 2017 that looked at 38 randomized clinical trials examining the use of mindfulness meditation either as a monotherapy or adjuvant to treat chronic pain. So overall, they found that there were statistically significant results of decreased pain, decreases in depression, and increases in both physical and mental well-being and quality of life. However, an important point to talk about in discussion is that they said there was a lot of heterogeneity in evidence, and that they described it as low quality evidence, mainly because it's heterogeneity, which basically means there's not a lot of consistency with the studies. The length of the intervention was quite low, and the sample size was quite small. So it's really hard to accurately determine an effectiveness. And obviously, in medicine, it's really important to understand what should be prescribed, how long, and what benefits can we realistically expect. Yes, we like the placebo effect, but it's not really ethically reliable to give something that may not be effective and give the placebo effect. But one thing they notice, which has been pretty consistent with the literature, is that the mental health aspects and benefits were very good evidence, very homogeneous, not heterogeneous, and they found very consistent, which is very consistent with the rest of the literature that is currently out there on applying mindfulness meditation in a whole variety of clinical situations. Also, what they noticed is that with the clinical trials, they were underpowered, too small of a sample size, but also intervention time was only 8 to 12 weeks. So what the literature and the evidence base really needs to go on forward is looking at larger sample sizes, longer time, 6 to 12 months. Because if you talk to really anybody who's a meditation or mindfulness teacher, they talk about the importance, and what the neuroscience seems to show is that being the long-term meditators, where you get a lot more of the benefits. There's definitely short-term benefits, but it's about that long-term benefits. And there's an important aspect of studying these longer-term periods of meditation for 6 to 12 months, and also looking at, are people able to adhere? Because that's the most important part. A lot of times I find, in my own experience in talking with the Zen master, North Shore Zendo, a lot of people go to meditation because there's some suffering, there's some anxiety, and they use the meditation and they get some benefits, they stick with it for a short period of time, but then they give it up because they say, oh, that problem I went for is done. My anxiety is gone, my depression's gone. But life has this kind of funny way of coming back to kick you in the ass if you kind of don't stick with the things. And I think sometimes meditation, we think we just have to meditate for a certain point, we come in line and we're fixed. But that's like having the mindset that I should exercise and work out so I get fit, and then once I get fit, I never have to exercise again. That's not really how life works. You have to continually practice and put in the work. And I say overall, the evidence is quite promising, but we don't really have the best available evidence right now. But mindfulness meditation is awesome because, one, it can be free. You can do it by yourself, and you can have ready access to great teachers. The North Shore Zendo is completely free. It's by donation. There's online so much resources. I have great videos. Definitely check out my meditation playlist if you want to learn more about meditation. There's so many great resources. You can find so many free group meditations. So there's no excuse not to apply it. It's a safe intervention and it empowers you. And it's been shown not only to improve the physical pain, but also the mental aspects, which is what I think is so cool about this intervention. Because I think one, it's free, it's very accessible. But two, with chronic pain, I think what makes it so fascinating and complicated to treat is not just the physical neurological changes and the physiological changes in the tissue, but also it has to do with psychosocial factors. And there's also a high burden of comorbid psychiatric conditions such as depression, anxiety, etc. And this is an intervention that seems to help with both at the same time. It's free and it's safe. So I really hope you enjoy this evidence-based review about using mindfulness meditation to help with chronic pain. So really hope you enjoyed this video. Please give it a big thumbs up and make sure to subscribe to continue getting more awesome videos by me. Help you kind of kick some more ass. Now get off YouTube and get meditating.